Hi everyone, I'm Dr. Z. I'm a clinical psychologist specializing in transgender care. Welcome to my channel. Today I would like to discuss with you the four, I believe it's four, I have it for 1, 2, 3, 4, I have to look at my notes because it's pretty dense topic. The four main typologies of gender dysphoria that I have personally observed in my clinical practice. Now, when we are talking about gender dysphoria, a lot of times we're talking about the distress the gender dysphoria causes. And a lot of times we are talking about symptomology that cluster together to create the diagnostic criteria for gender dysphoria. Gender dysphoria, as we know it, is a discomfort one feels with their gender assigned at birth and their authentic gender, the gender that they see or subjectively feel themselves to be. It could range from physical to social dysphoria. And as far as we know, we don't really, well, as far as I know, as far as research shows me, we don't really know what exact cause is of gender dysphoria. In other words, why is it that people do end up suffering and struggling with what we know as gender dysphoria? Well, over the course of my career, I started to observe in working with transgender adults. And I don't know if this is patterns that I'm observing with transgender adults are also patterns that other clinicians are observing with maybe children and their levels of development. But I'm only going to speak to adults because that's my focus and that's my expertise and that's the scope of my experience. What I started to observe is that gender dysphoria manifests differently in everybody. That's for certain. What I also started to observe is that the origins, the cause of gender dysphoria tends to vary. And sometimes the causes can and do overlap. A lot of times I observe that sometimes the cause can also determine the onset, meaning the starting point of when an individual is going to start to feel gender dysphoria or start to feel any kind of symptoms of gender dysphoria. And therefore, today I want to talk about the four most common typologies, what I call typologies of gender dysphoria. So imagine, if you will, the gender dysphoria is like this big distress, right? Which it is absolutely a big distress that you all feel. And I know that a lot of you are wondering, well, what caused this? What is the origin of this distress? So what I'm going to share are four main, again, typologies, meaning four main observations of potential causes. Some of these causes I have personally observed to be way more rare than others. And some of them, like I said, do overlap. So let's start with the first cause that I observe, that in the adult population that I work with, I tend to observe more frequently, way more frequently than the other three types of typologies. So the first typology of gender dysphoria falls in the category or generalization of physical dysphoria. What do I mean by physical dysphoria? This is the typology that focuses on the origin, the cause of gender dysphoria arising out of some physiological, physical set of criteria. For example, PCOS. For example, Klinefelter syndrome. For example, androgen insensitivity, prenatal exposure to hormones, endocrine receptive sensitivity. Other physical aspects that's going to fall into it could be neurological. It could be, disorders of sex development. In other words, we're talking about dysphoria arising out of some kind of physical ailment. This is no wonder why so many transgender adults feel like their brain literally wired as completely different gender, because there's something neurological going on there. There's something also biologically, physically based that is taking place here. This is why we're having some studies that shows that, yes, in fact, the brains of trans-identified females are different than the brains of, for example, cisgender men. The different parts of the brain light up that are much more in congruency with the same parts being cleared up, for example, women, the genders that they really see themselves to be. So the first one is the physical, and I will do a video for each one of these typologies a little bit more in detail after this video. And this way I just want to share with you typologies and would love to also hear your feedback. What do you think about these typologies? Because typologies are fascinating in a sense that we have some people that refuse to discuss typologies because they don't want to pathologize gender dysphoria. And in my professional opinion, gender dysphoria absolutely should be pathologized because it's a distress that causes people not only psychological distress, but physical distress to the point where people have to do something about it in order to feel better. What we don't want to pathologize is a gender identity. We don't want to apologize. You center who you are. Being transgender is not a pathology. Being non-binary is not pathology. There's nothing pathologizing about it. But the distress that person feel when we're talking about gender dysphoria is arising out of somewhere, right? And if we depathologize distress, then why are we also providing medical and surgical intervention when it is not, in other words, what are we doing here? We're just providing cosmetic alterations for individuals without any distress at all. So I think it's important to be able to understand that when we're talking about gender dysphoria, we're talking about symptomatic clusters that causes people a lot of distress, as you all know it. And nowhere is it about pathologizing gender variability. But because we live in a world where our bodies, our sexual identity based on chromosomal variability is being gendered, and is being gendered as only two genders, the distress is going to be there. And the distress is going to be also in proportion to the binary perception within which we tend to coexist. So the physical is the first one that I see. And like I said, the physical typology of gender dysphoria is by far the most common one that I see in adults. It is also the one that has either early or late onset. Onset meaning the starting point. I see this as you may have an early onset. A lot of you report age 4, 5, 6. You knew you were not comfortable with your gender assigned at birth. And then there's a lot of individuals who say that they don't really have that recollection. Again, not having recollection, remember, it could be about a lot of things. Your capacity to repress material, the environment you grew up in, how strict or how conservative your environment was, to what extent you were not able to express yourself. There's a lot of elements that go into it. And as a result, a lot of you do have later onset usually in late adulthood, around age, I would say 35, maybe even 30, to all the way age, you name it, 60, 70, where people just realize that they're struggling with gender dysphoria. So the physical origins, the physical cause of gender dysphoria for these individuals, again, carries with it early or late onset. The second typology that I witness in terms of causes of gender dysphoria is sexual. And a lot of you have been wondering about the theory of autogynephilia by Ray Blanchard, and we're wondering if I'm going to do a video about it, and I am going to do a video about it because I will be talking about this typology. Do I think the theory of autogynephilia, as Ray Blanchard proposes it, exists? Let me put it in this way. I think there is absolutely, and I have seen it, sexual causes of gender dysphoria that are rooted in erotomizing perceptions of yourself as a different gender, to the point where that perception seeps in and becomes part of your identity. I don't fully agree with exactly how Ray lays out his theory of autogynephilia, and I have a lot of questions about his theory. And there's a lot of things that I see differently around his theory. Nonetheless, I can't negate the fact that I personally, as a clinician, have observed in adults where the origin of their dysphoria has stemmed from sexual component, has stemmed from this erotomized point of view. So the sexual component is also a very interesting one, because up to probably, I would say, 7 years ago, I have seen this rarely in adults, older adults. This is also falls in the typology of presentations that I personally see rarely. whereas Ray Blanchard would say that it's much more frequent, that orthogonophilia is much more a frequent occurrence in presentation or in causes of gender dysphoria. In my experience, at least, it is far more rarer. But I have seen it, and I have seen people who themselves would identify and report as being orthogonophiles, saying that they feel comfortable with that really describes who they are. I think it's not fair to fully disregard the concept of sexuality as being typology of gender dysphoria, because we are seeing, I mean, just go on Reddit and look at some Reddit subgroups. There's people, adults, who say that, yes, that's how they see themselves. That's explain them to a T. So I think that is a possibility, because gender dysphoria is, trust me, is so incredibly complex. And the reason why it's so complex is because our gender and our gender identity, and I will do a video also how I conceptualize gender identity, the formation of gender identity in of itself is very complex. And it's not only your, when people say, oh, it's your subjective sense of who you are in relation to gender. Yes, that is true. It is your subjective sense of who you are in relation to gender. However, that subjectivity, that subjective sense is situated with an experience. And that experiences are connected to vectors of many things, including your biological sex, including the context where you grow up, including your environment, including the generation in which you were developmentally developing as a human being. This is why we're seeing discrepancies between older adults and their presentation of gender dysphoria and narrative and younger adults today, because that subjectivity and orientation to who you are in relationship to gender is centered specific around the context and time period in which you reside. So I'll do a video on that as well. As you can see, this is starting to be quite a bit of a more in-depth series on all this typology and understanding of gender dysphoria, and I think it's really important to talk about it. So to negate that there's a sexual origin to gender dysphoria, in my at least personal clinical experience, it would be, for me, glossing over and closing my eyes on what I have seen. In the past, like I said, I've been seeing this very rarely in older adults only. In the past, since then, I would say probably in a recent 5 to 6 years, I started to see presentation of this in younger adults. For me, younger adults, remember, would be probably age 18 to 27, 28. I consider that group younger adults. And the way that the sexual origin of dysphoria would manifest in younger adults would be where there's this confusion, almost identity confusion between erotomized sexual, I would say sexual normal and healthy desire and sexual fantasy of the feminine, and the confusion with gender dysphoria. And I've done a video on that, on pornography, and I've done a video on that. And with younger adults, I see this confusion. The reason why I see this confusion with younger adults and lesser of full development and merger of identity is because it has a later onset in them. It started out when a lot of their sense of identity has already solidified. With older adults, it usually starts at a younger age. This erotomized connection to erotomizing particular elements of gender, and it continues all the way into late adulthood to the point where, again, it merges and creates a sense of identity. And I'll talk again about this typology. It'll be a separate video just talking about this typology, but and I'll talk about what issues and I don't want to say concerns, but questions that I have as a clinician when I look at Ray Blanchard's theory. But does his theory exist? Yeah. Do I agree fully how he lays it out? No. But either sexual cause, if you will, to some individuals' experience of gender dysphoria? Yes, I would definitely say yes. Again, I think it's very rare. I would say physical cause of gender dysphoria in my experience with older adults is probably 85 maybe to 90%. Sexual cause of gender dysphoria in older adults, I would say probably maybe 2% that I have witnessed. Again, you have to take the percentages within the scope of how many clients have you seen, what's your exposure to the population, what their demographics. So again, be mindful, take everything with a grain of salt in terms of numerals. This is just generalized to my experience. And so we'll talk about it later in more detail. The third typology of gender dysphoria that I see, other than physical and sexual, is going to be a social typology. So it can be a little bit confusing because I know that some of you are thinking, well, social dysphoria obviously is going to be present because if you're feeling physical dysphoria, the social dysphoria is going to be there, which is, yes, this is why I say some of them overlap. But the social, up until very recently, up until probably again past 6-7 years, I have not seen social dysphoria as being the primary cause or origin of dysphoria in older adults. It always has been physical, and then social has been byproduct of physical, because obviously if you are physically feel like your body is not your body, and your body, the gender that you were assigned at birth is not the gender you identify with, and especially when you're developing secondary sex characteristics that are not in alignment with who you are, social is going to follow immediately, because the world is going to gender and interact with you based on the secondary sex characteristics and the binary view. So it's impossible to divorce physical from social when physical is initial cause. But here's what I'm seeing. With younger adults, again, I'm seeing the cause of gender dysphoria, social. What do I mean by that? I'll give you an example. A young adult, age 18, again, to 24, 25, young adult presenting with distress of gender dysphoria. And their distress is late onset, meaning that they never felt distress up until this point. So it's just started out, which is, again, nothing wrong with that, but it's rooted in social initial cause. So the roots of it are social. And the presentation looks, I'll give you a banal example, something like this. I feel very neutral about my physical body. I'm very comfortable, in fact, or comfortable or neutral, but don't have any kind of distress at all about secondary sex characteristics I have developed as a young adult. I'm totally fine. For example, I'm totally fine with my breasts, or I'm totally fine with my genitals, I'm totally fine with my chest, or facial hair, or you name it. All of the secondary sex characteristics which we gender. And I want to go into medical and surgical transition. When inquiring why one wants to go through modification of their secondary sex characteristic via surgical route, when they don't feel any distress about it at all, the response is this: because socially, how I see my gender identity is, for example, I see myself as a non-binary person. Just an example. This is not to generalize to non-binary people, because people take stuff out of context all the time. And this is the identity I feel comfortable with. But socially, it's giving me a lot of distress, because when I'm out there, people are constantly gendering me as one or another. And I'm not comfortable being misgendered all of the time when I'm out there socially. So now that I'm social out there, I want to align my body physically closer to either social expectations or either to the way I see myself, even though it doesn't give me distress. In other words, I recognize that my body is not giving me distress, but I also recognize that my body does not match up with the gender presentation I see myself to be. So you see, the roots are social, right? The roots are more embedded in our today's gender, I would say, the broadening of the gender ideas and the broadening and understanding of the gender. This is why, no surprise, I see this in younger adults, because, again, remember how I said the formation of gender identity is very anchored and centered as not only situated in a subjective context of the person, but also situated as a byproduct of particular time. So for younger adults, because they are growing up with the language, they are growing up with broader understandings that there are sex differences and sexual variability. And then there's also gender identities and gender variabilities. And so because they're branching out into this area that is giving them that understanding, people are young adults realizing and learning that, wait a second, I feel more comfortable of particular type of gender, non-binary, maybe a trans masculine gender, trans feminine gender, or any other gender identities out there. And the dysphoria begins as a social, because it is young adults reside in a context today where everything is so anchored, gender, in other words, is so deeply anchored to sexual variabilities. And they may feel more comfortable and more socially accepted within their peers, who also are more, I would say, fluid, more fluid, not only about gender concepts, but they don't necessarily gender the bodies immediately. But because they still live in a world where not everybody thinks like that, they will develop social dysphoria and distress about how they see themselves on the inside and how the world sees their bodies on the outside. So if you see yourself on the inside as a young adult of a particular gender, but the world sees you outside of only either male or female binary type of gender, you're going to develop a distress, which is stemming from social anxiety, not from physical anxiety, because physically you do feel comfortable with your body. So this is the typology of the gender dysphorias that I see starting to take place in younger adults. People ask me all the time, why should young adults then go through medical or surgical treatments when it's just social distress and it's not, and they feel neutral about their body? Well, it's complicated. It's not so easy. It's not a matter of why they should or why they shouldn't. The bigger question is they still eventually develop a physical distress. Remember how I said when you cause of gender dysphoria is physical to start with, social is inevitably byproduct of it. Well, in young adults, because I see social dysphoria only in young adults so far, think about it as reversed. When a social dysphoria in young adults is the starting point of dysphoria, physical is often inevitable byproduct of it. Why? Because again, they live in a world that genders based on binary point of view. So you are going to inevitably develop some form of physical distress based on that. Telling young adult that all you got to do is socially transition because you feel neutral about your body and you don't need to go through surgery to alter your secondary sex characteristic is a beautiful concept. And some are able to do it. And I wish we lived in a world where young adults or anybody whose cause origin of dysphoria is rooted in social are able to do it. Because if you truly feel neutral about your body, great, your body is great. The reality is that we don't live in that world. We live in a world where it's still so bad. This is why I will talk about the polarities, where on one hand, we have the world that keep telling everybody that there's only two genders, right? There's only male and female based on sexual variability. And people are so clinging to this view because they say they want to save younger generation from surgeries, gender affirming surgeries and procedures, but they don't realize by doing that, by clinging to the binaries, they're actually pushing the younger generation into this because it's causing them so much distress because the gendering is still happening based on binary perception. Again, I will do a separate video talking about it because it's such a complicated topic to wrap your head about it. It's such a complicated concept to understand how gender dysphoria could stem from social for young adults. It's much more maybe even philosophical in a sense, and to be able to also understand how it leads to physical distress and why a young adult would want to modify their secondary sex characteristics via surgery when they feel neutral about it. Again, who is to say that their distress does not warrant transition services, right? So it's very, it's like medical bioethics questions and I don't have the answers for them. I really don't. And I don't know what's right and wrong. All I know and all I see is that we're having adults and young adults, and also children with whom I also don't work, but I see them. I mean, I see them out there in the world who are having distress, and a lot of times very painful, debilitating distress that doesn't stop. And we need to start addressing a bigger scope of what causes this distresses versus just simplifying things into black and white. So social, like I said, I almost wanted to say seldom, but the truth is I never have seen social dysphoria as an origin of dysphoria in adults. It has been, in my experience, young adults that I've seen. So social is the anterior for, in my experience, has an onset later in life, and it's usually in demographically in younger adults. The final one, the first typology that I see that is also very, very rare in my experience with adults is trauma-based. Now, I've done a video where I talk about that the probability and possibility of developing gender dysphoria as a result of trauma with adults is like very rare. And I still stand by that. But I cannot negate also the typology because it does exist. And I think I even say in that video, I have seen one case of individual where they had such severe ongoing sexual and abusive and physical trauma in their life that in their adulthood, they identified with a different gender because they felt like if they were to transition, almost like this trauma never happened to them. Trauma-based origin to gender dysphoria, again, at least just in my experience, is very rare. I don't know if it's more common in other clinicians' experiences or in other demographic, but in mine, it's very rare. So there we have 4 typologies that I tend to observe over the time that I've been working with trans individuals. And I think it's important to talk about typologies because I think a lot of you out there are wondering what has caused me to have gender dysphoria. I think also understanding typologies, for example, understanding social typologies, can hopefully help us, all of us, especially the people on the far end who are pushing and keep trying to preserve the binary view, to understand how instead of solving a problem, that just creates a tension for so many younger adults, for younger generation. And it's causing so much tension that it thus leads inevitably to development of gender dysphoria. Like I said, gender dysphoria is, in my opinion, complex phenomenon. It is not something that afflicts every person. It is not something that is also super, super common. We see it in the news all the time. So we have a perception that a wider scope of population are struggling with gender dysphoria, and that's not exactly accurate. And it does happen, and when it happens, it's painful and it is debilitating. So it's important to understand or starting to discuss potential causes of it. And I'm sure there are causes beyond the ones I mentioned. These are just the ones that I kind of observed, and I started thinking and forming what is typological aspects to this here? How can this be broken down to typology? And like I said, physical, sexual, social, and trauma-based are the 4 main ones I've seen, with physical being about 90 to 95% of the adult population I have experienced having that stem from. Sexual is, I would say, like I said, about 2%. It's very super rare in my at least experience. Social, I see much more in younger adults than older adults. And then trauma-based is super, super rare. So I will do a video for each one of the typologies, go a little bit more in detail. What has my experience been with the typology of each kind of origin, if you will, of gender dysphoria? I doubt as a clinician we will ever get a society to one full conceptualization of what exact root of gender dysphoria, because I think the roots are many. I think as human beings, we are more complex than we realize. And I will also do a video on how I conceptualize, from psychological point of view, formation of gender identity. And I think since that video is going to help understand everybody why the typologies are also so important. Again, this is in no way to pathologize transgender identities. No. But it's important to also give roots and meaning and understanding to distresses people feel, because gender dysphoria is a distress and it's coming from somewhere. And it's not coming because people are suddenly getting brainwashed. No, there's roots, there's origins to all of the things. So comment below, let me know, what are your thoughts about these typologies? I know, for example, a lot of you think Ray Blanchard theory is complete bullshit. I know a lot of clinicians. I met a lot of colleagues who think his theory is not true, and that's okay. These are all theories, right? So even my conception of typologies are just my observation, based again on the demographic I work with and the scope of individuals I have seen over 15 years of my experience. It's not as black and white. I think it's really important to look at everything as trying to understand in order to ease the pain and suffering, and in order to find a best way to help people to either deal with gender dysphoria and make it better, or to help people find better coping when they can't do any kind of transition related steps. It's also really, really important here. So like I said, none of these typologies are to point finger and to say one is better than the other. And if you sometimes people say if you have physical origin to gender dysphoria, that's what they like to call true transgender. There's no such thing as true transgender. Again, we're talking about very complex distress, and the root to oftentimes to complex distress is much more deep and much more complex than we tend to realize. And it's important to also not to simplify dysphoria as transgender ideology. I mean, my God, I haven't even started talking about binary ideology, which I will, which is an ideology in of itself that we don't even realize we tend to perpetuate and sink in and relive and orchestrate every single day. So comment below, let me know what you think, what your thoughts are. I welcome all of your thoughts. Do you see maybe some element of your origin in the typology I described? Do you think, have you witnessed as yourself some other typologies that I have not brought to the table? Share below, comment, love hearing all of your thoughts and comments, and I'll talk to you all next time. Bye.